Hello, welcome to my channel. I'm Nikki, a registered osteopath, and today I'd like to take you through a few exercises to help with acute low back pain and muscle spasms. It's a follow along video, so hopefully it can just get you moving and help ease some of those symptoms. Give them a go and let me know how you get on. Okay, so starting laying on your back, we're going to start with some lumbar rotations or knee sways. Bring your feet into a planted position, then you're going to start gently rocking your knees side to side to create some rotation through your back. Each time, try to take your knees a little further than the time before. If it feels too much, you can reduce the range of motion again. And we're going to repeat this movement around 8 to 10 times on each side. As you can see, I'm taking my knees quite a lot further over now, really trying to allow a nice rotation and stretch through my lower back. It's okay if you don't feel you can take your knees that far, just go as far as feels comfortable for you. Next up, we have some pelvic tilts. So staying in this position, we're going to start rocking our pelvis forwards and backwards. This can be a really small movement. It's just to allow the lumbar spine to move into a nice supported extension and then back to neutral again. This movement can be as big or as small as you like, whatever feels right for you. I didn't think it was too easy to see in that video, so I've added this one in to try and make the movement a little more obvious. So as you can see, I'm gently arching my back by rotating my pelvis forwards and then slowly rotating back towards a neutral position. I'm exaggerating the movement in this video so that you can see it clearer. You don't need to create this much movement in your lower back for the exercise to be effective. It's just designed to get some gentle movement through that lumbar spine and keep you comfortable. Again, increase or decrease the range of movement as much as feels comfortable for you. Okay, so we're going to come into some knee hugs now. So taking one knee at a time, and bring the knee gently towards your chest. And the other one, leaving the other foot planted so that we're nice and supported. And each time bringing the knee a little bit closer than the time before. Nice and slow. Take it at your own pace. You can take as long as you need for each one. And just take the knee as close to your chest as is comfortable for you. If you struggle to flex your knee that much, you can interlace your fingers behind your knee and pull the leg closer towards you that way. That way you have less pressure going through the knee itself. So if you have a previous knee injury and you find it painful to bring your knee into such a bent position, that's an option for you. Okay, if comfortable, you can bring both knees up one at a time and slowly bring both knees into the chest and then repeat that. Nice and supported, taking it a little bit further each time. Good. Same option again. If you have knee pain and it hurts to flex your knees that much, you can have your hands behind the knees and bring the hands forward. Bringing the knees into the chest one last time. And then we're going to slowly lower our legs, taking one knee down at a time until our feet are planted again. And there we go. Last couple of things I'd like to leave you with are sleeping positions and ways of getting in and out of bed that might just help keep you comfortable over the next week or so. So give them a go and see if they work for you. Okay, so let's start with sleeping positions. Fold the pillow in half, pop it between your knees in a side lying position, and that's number one. You can try it without it folded in half as well if you prefer. And then option 2 is with a straight bottom leg and then a bent top leg, and then you support that top leg with a pillow. And then to get up, you're going to stay in your side lying position, extend your knees and then walk your hands closer to your hips until you're in a seated position. Okay, so don't forget you can also use ice and heat to help reduce the sensitivity, so 10 minutes of ice, 10 minutes of heat, or whichever one you find more comfortable, that can help. And keep active, try and keep moving, walking around, it's going to help reduce the stiffness in your back. If you found the video useful today, please like and subscribe and share it with friends and family that you think might also find it helpful, and good luck!